What are the emergency flu signs you should never ignore? Imagine feeling under the weather and thinking it's just a bad cold, but suddenly things take a serious turn. Recognizing emergency signs of the flu can be life-saving. These signs show that the illness has become severe and needs urgent medical attention. In adults, watch out for difficulty breathing or shortness of breath. If breathing feels labored or you're gasping for air, it's time to seek help. Chest pain or pressure, especially if it feels intense or persistent, is another warning. Sudden dizziness or feeling faint can indicate that your blood flow is compromised. Confusion or disorientation, where you feel lost or unable to think clearly, is a serious sign that the flu might be affecting your brain or causing low oxygen levels. Severe or ongoing vomiting that doesn't stop can lead to dangerous dehydration. Also, if flu symptoms initially improve but then suddenly worsen or come back with fever and cough, it could mean complications like pneumonia. In children, emergency signs are often different but equally urgent. If a child is struggling to breathe or their ribs are pulling in with each breath, it's a clear sign of respiratory distress. A bluish tint to the lips or skin indicates low oxygen levels and requires immediate care. If a child is extremely irritable or unresponsive, it's a sign that they are not coping well. Not crying tears when crying or having very few wet diapers can show dehydration from vomiting or fever. If they refuse to eat or drink fluids, it can worsen dehydration quickly. A high fever above 100 degrees Fahrenheit that doesn't respond to fever reducers or a fever lasting more than 3 days needs medical attention. Seizures or severe muscle pain that makes a child refuse to move or walk are also signs of serious complications. Sometimes, symptoms may improve and then worsen again, which is a warning to seek help immediately. Newborns have their own set of urgent signs. If they are unusually lethargic or have difficulty feeding, it's crucial to get medical help right away. These signs often mean the flu is causing severe illness or complications like pneumonia or dehydration in very young infants. These emergency signs are indicators that the flu has progressed beyond a mild illness and may be causing serious issues such as breathing problems, dehydration, neurological effects, or secondary infections. Acting quickly by going to an emergency room can prevent serious outcomes like hospitalization or even death. Most healthy people with mild symptoms can manage at home with rest, fluids, and over-the-counter remedies. But if you or your child show any of these emergency signs, don't wait. Seek medical care immediately. People at higher risk for complications, including young children, older adults, pregnant women, and those with chronic health conditions, should be especially vigilant and contact their healthcare provider if symptoms worsen or emergency signs appear. Remember, recognizing these signs early can save lives by ensuring prompt treatment. Never ignore difficulty breathing, chest pain, sudden dizziness, confusion, persistent vomiting, signs of severe dehydration, high or prolonged fever, or worsening symptoms after initial improvement. Always trust your instincts and seek medical help when needed.